We've developed this synthetic peptide vaccine platform over the last 2 decades.
So I'd like to start, before we introduce the founders of Kovac, with my partner, Dr. Peter Diamandis. And Peter, would you kind of cue up a little bit of how this has come about? Maybe introduce, if you would, Lou and Mehmet.
Sure. So Tony, I appreciate your time today. I've gotten to know Lou Reese and Mei who are here with me today as the co-founders and co-CEOs of the company we're talking about, Kovac. A parent company called United Biomedical is an incredible story, a 30-year-old company, one of the leading manufacturers of vaccines around the planet. UBI incredibly currently manufactures 500 million doses per year, 4.5 billion doses in animal health of the same exact vaccine platform. Talk about that.
Yeah, so UBI is the parent company of Kovac, and it's probably the oldest biotech company that you've never heard of. We cut our teeth in antibody testing and then developing vaccines, and we basically develop, manufacture them, and we've historically had third parties distribute them. But we've developed this synthetic peptide vaccine platform over the last 2 decades. We commercialized the first ever fully synthetic peptide vaccine against an infectious disease, and then next against endogenous protein. And what that means is, we never touch the virus. We're completely no biohazard risk. So we currently manufacture and vaccinate, against some of the most virulent infections, and we manufacture this in the middle of Shanghai City. So very rare, and it just kind of shows the safety of our platform. And as you mentioned, Peter, right now we manufacture 500 million doses a year. We've commercialized over 4.5 billion, so we know how to do it. We know how to scale up. We know how to deliver vaccines, and we can do it for under $1 a dose. So it's based on this platform that we've leveraged and now decided to basically apply it to COVID-19. And we're really excited about the results that we have so far that we're taking into humans.
When you say these human trials, you're talking the ones related to Alzheimer's, Parkinson's, are those the ones you're speaking of?
You're right, Tony. A sister company to Kovac, which is using the same platform, the same technology. Think about the same machinery, just a different tip, has been focused on Alzheimer's, Parkinson's, migraines, hypercholesteremia. And those 4 human clinical trials have demonstrated effectively a near perfect safety record. There's been minor adverse events, but nothing significant that we're concerned about. So we have a high degree of confidence that this platform is innately safe in humans, which a lot of the other vaccines don't yet have.
Can you give us maybe a metaphorical difference of what it's like to mix synthetic peptides to provide that laser-like response in the immune system, as opposed to building a factory that traditionally is being done out of using live virus as an example?
I mean, reality is that this is chemistry to mimic biology. And as a consequence, it's as simple as mixing paint. So when you're mixing chemicals, you can do it at scale. It's highly replicable, which means that you don't have bad batches. And it's highly scalable in a smaller area and at a much lower cost. So to put it in perspective, we can build plants for approximately 1/10 as much and deliver a larger number of annual doses.
How soon will you be going into human trials? Because you've been doing preclinical and animal trials. And where are you going to do that? And I understand the location in Nebraska that the DoD uses and that the President's, the POTUS office uses is the place that you're considering doing this, or have they already accepted you? Can you clarify both when you're going into human trials and some of the organizations that are part of this besides Taiwan? Because I understood, is Taiwan not paying 90% of your human trials? Is what I'd heard. I want to make sure if that's accurate.
Yeah, no, we have a very close relationship with the Taiwan CDE, and so we're on a rolling review, and our plan is to actually go into humans later this month. And they're going to help sponsor the phase 1 and the phase 2 trials there. Concurrently, we're actually doing trials in the US. We're doing a parallel trial. So we're doing a phase 1 with the University of Nebraska Medical Center, which is also the home of the National Quarantine Center and the Global Center for Health Security. These are the same guys that the Teddy Roosevelt captains came into, where the Diamond Princess cruise ship guys came into. These guys, saved the world. This is where if anyone in the U.S. has a question about it, they pick up a hotline, and it's University of Nebraska.
A wider known fact is that if you watch the movie Contagion or Outbreak, they're the guys in the suits that deal with the end of the world.
Yes, the Department and the Department of Defense goes to them, correct? And as well as the presidential's office to make those types of decisions.
It is basically the national
They're the
reference
highest
lab.
standard in the US at this stage, I guess.
It is. It serves the
Absolutely.
White House, the Department of Defense, the Pentagon. Like you said, this is the gold standard, and we're unbelievably blessed because they did the remdesivir trial, so that was the first treatment trial in the U.S., and they selected us as their vaccine trial. So
And they also did your testing. Are they not your exclusive partner for testing as well?
yeah, they tested. They did a wide screen of all the antibody tests out there, and they chose us as their exclusive serology partner, mainly because we're the most accurate test out there.